language also. My name is Dr. from Indonesia. I will bring a topic about 3D power Doppler in the evaluation of maternal placental circulation and the risk of recurrent pregnancy loss, especially due to hypertension, pregnancy, or death of the history. So, Doppler ultrasound waveform analysis of the maternal fetal circulation has emerged to add useful information in the determination of fetal well-being. Pregnancy is a period of very intensive fetal growth, and adequate placental and uterine blood flow is essential. Early studies suggested that Doppler ultrasound held great promise as a non-invasive, repeatable, and simple method of predicting hypertension in pregnancy and identifying those hypertensive pregnancy at high risk for maternal and fetal complication. Subsequent studies have emphasized the complexity of factors that may influence the pulse Doppler waveform analysis. It is so that 3D power Doppler ultrasound would uphold the original promise. Background: the spiral artery are transformed into distended low-resistance channels capable of increasing the blood supply to the fetal placental unit until the third trimester to 10 times that of the non-pregnant uterus. On the following slide, you can see the vascularization of the spiral arteries and the branches in the intervenous space with 3D power Doppler. In the future, the vascularization of these blood vessels will be the topic of our discussion in this presentation. The uteroplacental vascular adaptation is dependent on invasion of the spiral arteries by trophoblasts, which becomes incorporated into the vessel wall. This invasion occurs in a stepwise fashion, starting with purging of the distal ends of the arteries, followed by migration into the decidual segments, and after several weeks, delay into the myometrial segments. The first phase of this process starts from at least 8 weeks of gestation and continues to the 10 weeks, and the second phase is around 14 to 24 weeks. In the following slides, we look at the branches of the uterine arteries and the measurement of their blood flow, which is the forerunner of the prediction of hypertension in pregnancy. To evaluate the use of 3D Doppler in the identification of pregnant women who are at risk of recurrent miscarriage is our background to increase blood pressure. It has been postulated that hypertension and growth restriction could lead to hypertensive cardiovascular disease in adult life. On the following slide, you can see how we take a blood flow from the uterine sample artery branch. And the use of 3D power Doppler makes it easier for the blood flow signal to be captured very clearly. This is the branch of the uterine artery from the iliac artery using the 3D power Doppler. We have published previous research of the 3D power Doppler ultrasound that enables assessment of the vascular signals within the whole investigated area. Hemodynamic changes included in the process of placentation are one of the most exciting topics in the investigation of early human development. Once again, with the help of 3D power Doppler, you can see easily, we can see the branching in the intervenous space. The hypothesis, placental and spiral arteries in normal pregnancy increase as gestational progresses with some abnormal findings in hypertension. The aim of study to define normal placental blood flow as assessed by 3D power Doppler in the second trimester of pregnancy and to compare findings with the woman with hypertension. Our exclusion criteria, no maternal disease before gestational firmly established, and single pregnancy at 20 to 14 weeks. The exclusion criteria is fetus with anomaly, pregnancy complicated with other disease, and unknown pregnancy outcome. Each patient had a 3D power Doppler ultrasound exam and automatic volume acquisition of the spiral artery and placental blood flow was obtained. At least 5 subsequent measurements were obtained on each target and stored into the computer for further analysis using the 4D program. We use the help of the focal volume calculation analysis software to measure blood flow from the placenta. Here, in the following tutorial, I will explain how to take the volumetric sample of blood flow. You see the branching of the spiral artery. We took the sample biopsy. This is the first arterial placental spiral artery. When you have already the good image, then we set the volume of the sphere sample ball volume. Usually we use 30 degree of the ball sphere measurement, and select the automatic measurement, and then the computer will automatically measure the existing vascular index, namely flow index, vascular flow index, and vascular flow index. And we see the result immediately by ultrasound analysis from the computer. The 3D power Doppler index in the following table, we can see the difference between the 3 vascular indexes from power Doppler, where each index is measured based on difference in the color, value of amplitude, and intensity of the blood flow. The endpoint of the study was pregnancy outcome, normal full-term pregnancy or pregnancy complicated with hypertension, normal value of placental blood flow as assessed by 3D Doppler to establish for pregnancy between 20 to 40 weeks of gestation. The diagram created reflects standard statistical procedure using polynomial regression, and upper and lower limit reflect 95% confidence interval. Based on standard errors of the regression, adjusted for sample size and variability at each gestational age interval. Total 80 patients with normal pregnancy and 40% with the preeclampsia. Here you can see the description of some of displayed parameters on the group and the control group. And in the result of the study, there was a significant difference in the decrease in all vascular index in hypertension condition compared to normal condition. This is the pattern of distribution of vascular index value in preeclampsia normal case. You see that all of the patients with preeclampsia have a lower index than the normal. Well, this is the pattern of distribution of flow index value in patients with normal and preeclampsia. And this is the pattern distribution of vascular flow index value in preeclampsia and normal case. Statistical analysis demonstrated a significant difference in all 3D power Doppler index with gestational age, with volume vascular index show a less significant relation, and vascular flow index has the most significant relation. Patients with preeclampsia show some abnormal 3D Doppler index before onset of the disease. Placental vascular index slowly increase, indicating progressive development of vascular network and increase in the volume blood flow. These changes were not rapid in nature but rather slow progressing. The tendency of a sudden decrease in the blood flow index, like volume vascular index, volume index, and vascular flow index in patients with preeclampsia is quite opposite to the tendency of steady or very slow increase of this index in pregnancy with normal outcome. Most likely, these changes in 3D Doppler could reflect profound changes in the hemodynamic placenta and especially spiral artery in patients suffering from preeclampsia. Patients with preeclampsia show abnormality in some 3D ultrasound index. If proven clinically useful in large-scale prophetic study, this could establish a foundation for either in vivo recognition of hemodynamic changes in preeclampsia and possibly in growth restriction. Preeclampsia and growth restriction are among the leading cause of perinatal maternal morbidity and mortality. And long-term implications for health include growing evidence of fatality of adult disease. Here I will show again how we can measure offline the placental vascular index in our personal computer in sample of a case of 32 weeks pregnancy, where the measurement is done offline on personal computer. You just save the volume and we can do it at home. We can do it at any time. First you take the sample and then choose the sample volume sphere. This is I done in my laptop. And you take the automatic measurement. And the computer will calculate and display the 3 consecutive index. Here the computer make the volume sphere measurement. We just put some sample on the placenta. And then put the calculation histogram of the 3 indices. After we get the result, it is example the value of vascular index is around 16.63. Then we plot it on the scatter diagram. And this is sample from flow index 35. We plot in the scatter diagrams. And this is the vascular flow index 5.8. And also we put in the scatter diagram. From the conclusion, the vascularization index parameter may not be suitable for practical use in clinical obstetric everyday. However, the measurement of placental vascular index using 3D powder again is quite substantial. Our study indicated that placental arterial blood flow increased with the advancement of gestational age, and patients with preeclampsia show some abnormality Doppler index before onset of disease. This is the end of my case presentation. Thank you very much for your attention.
Thank you, Doctor. It was a very nice presentation. Any questions?
Coming to the practical application of your study, is it going to help us in monitoring our patients of preeclampsia so as to time delivery? How is it going to help us?
Actually, it's very time consuming and it's not usually make sense to do the measurement every time we measure. Usually I just do the uterine artery measurement, but vascular Doppler index is I think quite substantial for the measurement of the, if we know already that the patient has already had some bad obstetric history before.
Do we have nomograms for this flow index and the other indices so that we know what is normal and what is not normal? Do we already have, or is it population based?
This is not, I think, I have the index because I just do the 40 patient, yeah. And it's in our population in Indonesia, and it just only take for 20 to 40 weeks. I don't think that the index will be covered for normal and total population in our world.
So now,
Yeah, maybe with the last studies or with thousands of patients.
how do you think this will benefit in the general population? The knowledge about these indices and the way that they are able to predict preeclampsia. Will you be able to extrapolate it to the general population where we can identify those women who are likely to develop preeclampsia?
Yeah, we have to acknowledge that it's very difficult to perform. This is like a regular test is for everybody with the preeclampsia. But maybe in the future we just make a simple measurement, and you know that it depends also the machine. If you don't have the machine like you using the very sophisticated machine, it's very difficult. Yeah, but I think it's Doppler is enough to measure.
How long does it take for you to measure for one patient?
For me, it's just I'm doing in the laptop. It's only take 5 to 10 minutes only. We just make a sample volume for the placenta.
For him, not for me.
And the calculation done by the vocal, yeah, and like I showed you before, it's maybe in 20 seconds, I think. Very fast, the computer do the measurement by automatic sphere, and then they show the measurement directly. And then I make comparison with the normal, and it's very, very different from the preeclampsia.
Someday,
Yeah.
be useful.
Maybe with the last studies. Thank you very much, Moderator.